Hello, everybody. Thank you for joining me again. This is MJ, the coding coach. Make sure you're subscribed, so hit that subscribe button right at the bottom. Also, hit that notification bell so you'll be notified each time that I have a new video. So, today's video is going to be about annual wellness visits, AWVs. If you're dealing with Medicare, things like that, you are used to hearing about annual wellness visits. And we abbreviate those by calling them AWVs. So I am going to go through some information about AWV visits, annual wellness visits, and we'll talk about what that consists of. So an annual wellness visit is a yearly appointment with your primary care doctor to create or update a personalized prevention plan. Now, this plan may help prevent illness based on your current health and risk factors. Now, keep in mind that the AWV or the annual wellness visit is not a head-to-toe physical. It's not one. The yearly wellness visit is not a physical exam. So understand that an annual wellness visit and a physical exam are two totally different visits. Now, what's included in an AWV? In an AWV, a review of your medical history, your family history, a review of your current providers and prescription medicines, your height, weight, blood pressure, and other routine measurements, personalized health advice, and a list of risk factors and treatment options for the patient. That's included in the AWV. Now, your insurance for your annual wellness visit does not cover any discussions of treatment or prescription medications for chronic illnesses or conditions such as high blood pressure, high cholesterol, or diabetes. Now, physical exam. Let's talk about a physical exam. Now, the physical exam helps your doctor figure out what the problem is and what needs to be done. A wellness exam helps your doctor understand what's working for you and how to best support your continued health and well-being. Now, let's talk about what's included in a physical exam. So they visually check your body for overall signs of existing health issues. Look into your eyes, ears, nose, and throat for potential problems. Listen to your heart and lungs and detect any irregular sounds, any abnormalities there. They touch your body parts to feel for abnormalities. They test your motor skills, motor skills, and your motor functions and your reflexes. Perform pelvic and rectal exams, and also measure your height, weight, and blood pressure. Now, as a rule, Medicare does not cover an annual physical. The exam and any test your doctor orders are separate services and may have costs related to each depending on your Medicare plan. So, know that depending on the Medicare plan, physical exam is typically not covered. So, there is, under the Medicare of your annual wellness visit, they have what you call your Welcome to Medicare. Welcome to Medicare visit. It's part of your Medicare Part B. And it's also known as your IPPE, which is your initial preventative physical exam. Now, it's eligible for benefit the person is eligible for this once within the first 12 months that they're enrolled in Medicare Part B. The first 12 months that they're enrolled into Medicare Part B, they're to have a welcome to Medicare visit. Now, included in this visit, they're going to record and evaluate the medical and family history, current health conditions and prescription medicines, check the blood pressure, vision, weight, height to get a baseline for the care. Make sure that they're up to date with preventative screenings such as colonoscopies, cancer screenings, vaccines, immunizations, things like that, and order future tests depending on the general health and medical history. For annual wellness visits, you're typically going to use The codes G as in girl 0438, that's for the initial wellness visit, and G0439 for the subsequent annual wellness visit. Also, with annual wellness visits, there can also be a problem-oriented E&M code used as well for the office visit. You know, like a 99 for a new patient, 9903. Or for established patient, 99213, which is a level 3 for either a new patient or an established patient. So understand that even with an annual wellness visit, you can also use problem-oriented E&M codes as well. And you will also use a modifier 25 to signify or to reflect that there is a separate identifiable E&M services. So, again, remember I said the annual wellness visit is not a head-to-toe physical. So if the doctor is there and they are checking on chronic conditions, ordering new prescriptions, or anything that requires separate documentation, then you're going to add the problem E&M visit according to what level it is, also added with the annual wellness visits. So some people think you have to code for either or. No. You can have an annual wellness visit, and if something is wrong with this patient, or if the patient complains of something else during this annual visit, and the provider checks this something else out, and they feel like it needs separate documentation or order prescriptions for this illness or whatever it is, then you're going to use a problem-oriented E&M in addition with a modifier 25, in addition to the annual wellness visit code. So, drop your questions below if you have any questions concerning the annual wellness visits, problem-oriented E&M. So, as you also know, there were changes made to E&M codes in 2021. So, again, there are going to be changes to the E&M codes starting 2023. So also when we talk about separate documentation for problem-oriented E&Ms related to annual wellness visit, well, let me tell you some of the things that can support separate E&M reporting. And this is how you're going to know if you need a separate E&M code to go along with the annual wellness visit. Now, while this is not directly absolute, now some of these issues can support separate E&M reporting. Things like exacerbation of a chronic condition. If the patient is coming in there for an annual wellness visit and they have a chronic condition and it's worsening or it's severe, that can be reported as a separate E&M because there's separate documentation. A new condition that requires additional work. New or changed prescription, or if it's a required follow-up for a certain condition. Those all require separate documentation, which means there's a separate E&M code with the annual wellness visit code, those G codes that we just talked about. So again, leave your questions below. I hope you learned some things about annual wellness visits and physical exams. Also problem-oriented E&M that can be appended to these codes as well for the patient's visit. Drop your questions below. I'll be glad to answer it. Again, don't forget to like, comment, share, and subscribe, and hit that notification bell so you'll be notified each time I drop a new video. Thank you so much. And what I'm going to do as well, I will come back in my next video is going to be going through a chart for an annual wellness visit alone, and we'll code it. And then we'll go through a chart with the annual wellness visit and a problem-oriented E&M, and we'll talk about the differences. Thank you so much. Bye.